are dentists in your respective countries able to provide patients with oral appliance therapy without physician involvement? Dr. Haviv, what's the matzav in Israel?
In Israel, the option of dental appliance for sleep apnea is completely private. It can be done, and it is usually done without a physician involvement, even though we prefer one. In my case, most of the patients are being referred from ENTs or sleep labs. Also, by the way, Dr. Priemer said something about the tumor, but most of the patients in Israel that are being checked in the sleep lab, they are not being referred to ENT. They get CPAP immediately. So it is not the best thing to do, but it is the, you know, it's not only dentists are to blame with this problem. Now, some private insurance demand ENT referral along with sleep test as a must in order to get refund. This is since dental appliance is considered a surgery replacement in insurance policy. So this is the situation in Israel.
So, Dr. Martin, I'm going to ask you a little bit of a different question.
Sure.
So the fact that in the United States, a dentist really has to have a diagnosis to make an appliance, how has that impacted access to therapy?
Listen, you know, along the lines of the last question and this question, I know dentists that make appliances and just bill them fee for service. Now, I would never do that. To me, every patient that I suspect of having a sleep issue, I tell them, listen, you need a sleep evaluation. I don't even tell them they need a sleep test. And to me, you know, like what Les said, it's liability, and especially on the patients that have severe systemic comorbidities, the physician needs to be involved. And anytime a patient says they snore or a parent tells me their son or daughter snores, they're getting a sleep evaluation. To me, there's no such thing as benign snoring. And in terms of, you know, access, that's the real problem, I think, in the US. You know, for a dentist to make a sleep appliance, for an insurance to pay for it, the patient needs a letter of medical necessity by the physician. And I think in the US, it's really been piecemeal together, right? The way I've done it is, if I suspected a patient of having a sleep problem, I send them to the ENT. The ENT prescribes a home sleep test or an in-lab study. Then it needs to be read by a board-certified sleep physician. A letter of medical necessity needs to be generated. And then the patient gets sent back to me for the oral appliance therapy. It could take 3 or 4 months, and the patients are losing steam. And then the billing on top of it.